Okay, so now we're going to be looking at a cervical vertebrae, or what a typical cervical vertebrae looks like. So right now we're looking at it superiorly, and we can tell it's superior because of the way the articular facets point upwards. Okay, now you need to know a few structures on this vertebrae. The first one being the body, just on that superior and inferior surface. It looks like this, and is the weight-bearing portion of the vertebrae. Next, we have the pedicle. So the pedicle is located right here and is this section of the bone connecting the body and these articular facets. And then if you move to the back, we have the lamina of the vertebrae, which is connecting the spinous process dorsally to those facets. Next, we have the vertebral notches. So when these vertebrae all stack up on top of each other, they make notches that allow spinal nerve passage. You have one superiorly, which is shown right here. And inferiorly, it's a little bit harder to see, but it's this notch here. So if you can imagine these vertebrae stacked, the inferior one and the superior one from the one below it will make up that passageway. Okay. Like C1 and C2, we still have transverse processes, but they're broken up a little bit differently. So you have an anterior portion and a posterior portion of the transverse processes, and they're tubercles. So the anterior tubercle and the posterior tubercle of the transverse process. And we still have our transverse foramen, which the vertebral artery will pass through. And we have the superior articular facets and the inferior articular facets. So the inferior articular facet will articulate with the vertebrae below it. That vertebrae is superior one, whereas this superior facet will articulate with the inferior facet of the vertebrae above it. And something I just want to point out, with a dogmatic or typical cervical vertebrae, you will have this bifid process, and the exception to that rule is actually C7, because it has a nice prominent one, but it's not bifid.